Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 30 practice questions. Without the way, let's get started.
The home healthcare nurse is talking on the telephone to a male client diagnosed with hypertension and hears the client sneezing. The client tells the nurse he has been blowing his nose frequently. Which question should the nurse ask the client? 1. Have you had the flu shot in the last 2 weeks? 2. Are there any small children in the home? 3. Are you taking over-the-counter medicine for these symptoms? 4. Do you have any cold sores associated with your sneezing? The correct answer is 3. Are you taking over-the-counter medicine for these symptoms? A client diagnosed with hypertension should not take many of the over-the-counter medications because they work by causing vasoconstriction, which will increase the hypertension. Influenza is a viral illness that might cause these symptoms. However, an immunization should not give the client the illness. Coming into contact with small children increases the risk of contracting colds and the flu, but the client has a problem, not just a potential one. Cold sores are actually an infection by the herpes simplex virus. Colds and cold-like symptoms are caused by the rhinovirus or influenza virus. The term cold sore is a common term that still persists in the populace. The keys to answering this question are the words hypertension and cold. Anytime a client has a chronic illness, the client should discuss over-the-counter medications with the healthcare provider or a pharmacist. Many of the routine medications for chronic illnesses interact with over-the-counter medications. The school nurse is presenting a class to students at a primary school on how to prevent the transmission of the common cold virus. Which information should the nurse discuss? 1. Instruct the children to always keep a tissue or handkerchief with them. 2. Explain that children current with immunizations will not get a cold. 3. Tell the children they should go to the doctor if they get a cold. 4. Demonstrate to the students how to wash hands correctly. The correct answer is 4. Demonstrate to the students how to wash hands correctly. Hand washing is the single most useful technique for prevention of disease. Colds are caused by a virus, and antibiotics do not treat a virus. Therefore, there is no need to go to a healthcare provider. There is no immunization for the common cold. Colds are actually caused by at least 200 separate viruses, and the viruses mutate frequently. It is not feasible for a child to always have a tissue or handkerchief available. Option 1 contains the word always, an absolute word, and in most questions, absolutes such as always, never, and only make that answer option incorrect. Which information should the nurse teach the client diagnosed with acute sinusitis? 1. Instruct the client to complete all the ordered antibiotics. 2. Teach the client how to irrigate the nasal passages. 3. Have the client demonstrate how to blow the nose. 4. Give the client samples of a narcotic analgesic for the headache. The correct answer is 1. Instruct the client to complete all the ordered antibiotics. The client should be taught to take all antibiotics as ordered. Discontinuing antibiotics prior to the full dose results in the development of antibiotic-resistant bacteria. Sinus infections are difficult to treat and may become chronic and will then require several weeks of therapy or possibly surgery to control. If the sinuses are irrigated, it is done under anesthesia by a healthcare provider. Blowing the nose will increase pressure in the sinus cavities and will cause the client increased pain. The nurse is not licensed to prescribe medications, so this is not in the nurse's scope of practice. Also, narcotic analgesic medications are controlled substances and require written documentation of being prescribed by the healthcare provider. Samples are not generally available. Note in this situation, an all is in the correct answer. There are very few cases in which absolute adjectives will describe the correct answer. You must be aware that general rules will not always apply. The client has been diagnosed with chronic sinusitis. Which sign-symptom alerts the nurse to a potentially life-threatening complication? 1. Muscle weakness. 2. Purulent sputum. 3. Nuchal rigidity. 4. Intermittent loss of muscle control. The correct answer is 3. Nuchal rigidity. Nuchal rigidity is a sign-symptom of meningitis, which is a life-threatening potential complication of sinusitis resulting from the close proximity of the sinus cavities to the meninges. Intermittent loss of muscle control can be a symptom of multiple sclerosis, but it would not be a life-threatening complication of sinusitis. Muscle weakness is a sign-symptom of myalgia, but it is not a life-threatening complication of sinusitis. Purulent sputum would be a sign-symptom of a lung infection, but it is not a life-threatening complication of sinusitis. A basic knowledge of anatomy and physiology would help to answer this question. The sinuses lie in the head and surround the orbital cavity. Options 1 and 4 refer to muscle problems, so both could be ruled out as wrong. The client diagnosed with tonsillitis is scheduled to have surgery in the morning. Which assessment data should the nurse notify the healthcare provider about prior to surgery? 1. The client has a hemoglobin of 12.2 grams per deciliter and hematocrit of 36.5%. 2. The client has an oral temperature of 100.2 degrees Fahrenheit and a dry cough. 3. There are 1 to 2 white blood cells in the urinalysis. 4. The client's current international normalized ratio is 1.0. The correct answer is 2. The client has an oral temperature of 100.2 degrees Fahrenheit and a dry cough. A low-grade temperature and a cough could indicate the presence of an infection, in which case the healthcare provider would not want to subject the client to anesthesia and the possibility of further complications. The surgery would be postponed. The hemoglobin and hematocrit given are within normal range. This would not warrant notifying the healthcare provider. 1 to 2 WBCs in a urinalysis is not uncommon because of the normal flora in the bladder. The INR indicates that the client's bleeding time is within normal range. In this question, all the answer options contain normal data except for one. The nurse would not call the healthcare provider to notify him or her of normal values. The influenza vaccine is in short supply. Which group of clients would the public health nurse consider priority when administering the vaccine? 1. Elderly and chronically ill clients. 2. Childcare workers and children less than 4 years of age. 3. Hospital chaplains and healthcare workers. 4. School teachers and students living in a dormitory. The correct answer is 1. Elderly and chronically ill clients. The elderly and chronically ill are at greatest risk for developing serious complications if they contract the influenza virus. It is recommended people in contact with children receive the flu vaccine whenever possible, but these clients should be able to withstand a bout with the flu if their immune systems are functioning normally. It is probable these clients will be exposed to the virus, but they are not as likely to develop severe complications with intact functioning immune systems. During flu season, the more people the individual comes into contact with, the greater the risk the client will be exposed to the influenza virus, but this group of people would not receive the vaccine before the elderly and chronically ill. Sometimes, you may think the answer is too easy and obvious, but you should not try to second-guess the question. Test writers are not trying to trick you, they are trying to evaluate knowledge. The client diagnosed with chronic sinusitis who has undergone a Caldwell-Luke procedure is complaining of pain. Which intervention should the nurse implement first? 1. Administer the narcotic analgesic IVP. 2. Perform gentle oral hygiene. 3. Place the client in semi-Fowler's position. 4. Assess the client's pain. The correct answer is 4. Assess the client's pain. Prior to intervening, the nurse must assess to determine the amount of pain and possible complications occurring that could be masked if narcotic medication is administered. The client has complained of pain, and the nurse, after determining the severity of the pain and barring any complications in the client, will administer pain medication after completion of the assessment. Oral hygiene helps to prevent the development of infections and promotes comfort, but it will not relieve the pain. Placing the client in the semi-Fowler's position will reduce edema of inflamed sinus tissue, but it will not immediately affect the client's perception of pain. Whenever there is an assessment answer among the answer options, you should look carefully at what is being assessed. If the option says to assess the problem identified in the question, it will usually be the correct answer. Remember, The first step in the nursing process is assessment. The charge nurse on a surgical floor is making assignments. Which client should be assigned to the most experienced nurse? 1. The 36-year-old client who has undergone an antral irrigation for sinusitis yesterday and has moderate pain. 2. The 6-year-old client scheduled for a tonsillectomy and adenoidectomy this morning who will not swallow medication. 3. The 18-year-old client who had a Caldwell-Luke procedure 3 days ago and has purulent drainage on the drip pad. 4. The 45-year-old client diagnosed with a peritonsillar abscess who requires IVPB antibiotic therapy 4 times a day. The correct answer is 3. The 18-year-old client who had a Caldwell-Luke procedure 3 days ago and has purulent drainage on the drip pad. The post-operative client with purulent drainage could be developing an infection. The experienced nurse would be needed to assess and monitor the client's condition. Any nurse who is capable of administering IVPB medications can care for this client. This client is 1 day post-operative and has moderate pain, which is to be expected after surgery. A less experienced nurse can care for this client. A child about to go to surgery involving the throat area can be expected to have painful swallowing. This does not require the most experienced nurse. In this type of question, you must determine if the situation described is expected or within normal limits. The option that gives unexpected data or data not within normal limits requires a nurse with more knowledge and experience. The client diagnosed with influenza A is being discharged from the emergency department with a prescription for antibiotics. Which statement by the client indicates an understanding of this prescription? 1. These pills will make me feel better fast, and I can return to work. 2. The antibiotics will help prevent me from developing a bacterial pneumonia. 3. If I had gotten this prescription sooner, I could have prevented this illness. 4. I need to take these pills until I feel better, then I can stop taking the rest. The correct answer is 2. The antibiotics will help prevent me from developing a bacterial pneumonia. Secondary bacterial infections often accompany influenza, and antibiotics are often prescribed to help prevent the development of a bacterial infection. Antibiotics will not prevent the flu. Only the flu vaccine will prevent the flu. When people take portions of the antibiotic prescription and stop taking the remainder, an antibiotic-resistant strain of bacteria may develop, and the client may experience a return of symptoms. But this time, the antibiotics will not be effective. A person with a viral infection should not return to work until the virus has run its course, because the antibiotics help prevent complications of the virus, but they do not make the client feel better faster. The nurse is developing a plan of care for a client diagnosed with laryngitis and identifies the client problem, altered communication. Which intervention should the nurse implement? 1. Instruct the client to drink a mixture of brandy and honey several times a day. 2. Encourage the client to whisper instead of trying to speak at a normal level. 3. Provide the client with a blank notepad for writing any communication. 4. Explain that the client's aphonia may become a permanent condition. The correct answer is 3. Provide the client with a blank notepad for writing any communication. Voice rest is encouraged for the client experiencing laryngitis. Aphonia, or inability to speak, is a temporary condition associated with laryngitis. The client with laryngitis is instructed to avoid all alcohol. Alcohol causes increased irritation of the throat. Whispering places added strain on the larynx. Encouraging the use of alcohol, with the exception of a glass of red wine, is not accepted medical practice. Therefore, option 1 could be eliminated. Option 4 has an absolute, permanent, in it, and therefore could be eliminated from consideration. Which task is most appropriate for the nurse to delegate to an unlicensed assistive personnel? 1. Feed a client who is post-operative tonsillectomy the first meal of clear liquids. 2. Encourage the client diagnosed with a cold to drink a glass of orange juice. 3. Obtain a throat culture on a client diagnosed with bacterial pharyngitis. 4. Escort the client diagnosed with laryngitis outside to smoke a cigarette. The correct answer is 2. Encourage the client diagnosed with a cold to drink a glass of orange juice. Clients with colds are encouraged to drink 2,000 milliliters of liquids a day. The UAP could do this. Tonsillectomies cause throat edema and difficulty swallowing. The nurse must observe the client's ability to swallow before this task can be delegated. Throat swabs for culture must be done correctly, or false negative results can occur. The nurse should obtain the swab. Clients with laryngitis are instructed not to smoke. Smoking is discouraged in all healthcare facilities. Sending nursing personnel outside encourages an unhealthy practice, which is not the best use of the personnel. Interventions requiring assessment, teaching, and evaluation cannot be delegated. Levels of activities being delegated should be appropriate for the level of training of the staff member carrying out the task. Tasks delegated must conform to safe healthcare practice. The nurse is caring for a client diagnosed with a cold, which is an example of an alternative therapy. 1. Vitamin C 2,000 milligrams daily. 2. Strict bed rest. 3. Humidification of the air. 4. Decongestant therapy. The correct answer is 1. Vitamin C 2,000 milligrams daily. Alternative therapies are therapies not accepted as standard medical practice. These may be encouraged as long as they do not interfere with the medical regimen. Vitamin C in large doses is thought to improve the immune system's functions. Bed rest is accepted standard advice for a client with a cold. Humidifying the air helps to relieve congestion and is a standard practice. Decongestant therapy is standard therapy for a cold. Only one of the answer options is not common advice for a client with a cold. When all options but one match each other, then the odd option should be selected as the correct answer. The nurse is assessing a 79-year-old client diagnosed with pneumonia. Which signs and symptoms should the nurse expect to assess in the client? 1. Confusion and lethargy. 2. High fever and chills. 3. Frothy sputum and edema. 4. Bradypnea and jugular vein distension. The correct answer is 1. Confusion and lethargy. The elderly client diagnosed with pneumonia may present with weakness, fatigue, lethargy, confusion, and poor appetite, but not have any of the classic signs and symptoms of pneumonia. Fever and chills are classic symptoms of pneumonia, but they are usually absent in the elderly client. Frothy sputum and edema are signs and symptoms of heart failure, not pneumonia. The client has tachypnea, not bradypnea, and jugular vein distension accompanies heart failure. The nurse is planning the care of a client diagnosed with pneumonia and writes a problem of impaired gas exchange. Which is an expected outcome for this problem? 1. Performs chest physiotherapy 3 times a day. 2. Able to complete activities of daily living. 3. Ambulates in the hall several times during each shift. 4. Alert and oriented to person, place, time, and events. The correct answer is 4. Alert and oriented to person, place, time, and events. Impaired gas exchange results in hypoxia, the earliest sign-symptom of which is a change in the level of consciousness. Clients do not perform chest physiotherapy. This is normally done by the respiratory therapist. Option 1 is a staff goal, not a client goal. Option 2 would be a goal for self-care deficit, but not for impaired gas exchange. Option 3 would be a goal for the problem of activity intolerance. You should match the answer option to the listed nursing problem. When writing goals for the client, it is important to remember they are written in terms of what is expected of the client. The nurse in a long-term care facility is planning the care for a client with a percutaneous endoscopic gastrostomy feeding tube. Which intervention should the nurse include in the plan of care? 1. Inspect the insertion line at the nares prior to instilling formula. 2. Elevate the head of the bed after feeding the client. 3. Place the client in the Sims position following each feeding. 4. Change the dressing on the feeding tube every 3 days. The correct answer is 2. Elevate the head of the bed after feeding the client. Elevating the head of the bed uses gravity to keep the formula in the gastric cavity and help prevent it from refluxing into the esophagus, which predisposes the client to aspiration. A gastrostomy tube is placed directly into the stomach through the abdominal wall. The nares is the opening of the nostril. The Sims position is the left lateral side-lying flat position. This position is used for administering enemas and can be used to prevent aspiration in clients sedated by anesthesia. The sedated client would not have a full stomach. Dressings on PEG tubes should be changed at least daily. If there is no dressing, the insertion site is still assessed daily. The nurse is discussing the neonatal blood screening test with a new mother. The nurse knows that the teaching was successful when the mother states that the test screens for the presence in the newborn of which of the following diseases? Select all that apply. 1. Hypothyroidism. 2. Sickle cell disease. 3. Galactosemia. 4. Cerebral palsy. 5. Cystic fibrosis. The correct answers are 1. Hypothyroidism, 2. Sickle cell disease, 3. Galactosemia, and 5. Cystic fibrosis. Congenital hypothyroidism is a malfunction of or complete absence of the thyroid gland that is present from birth. It is screened for in all 50 states. Sickle cell disease is an autosomal recessive disease resulting in abnormally shaped red blood cells. It is screened for in all 50 states. Galactosemia is an incurable autosomal recessive disease characterized by the absence of the enzyme required to metabolize galactose. It is screened for in all 50 states. Cystic fibrosis is an autosomal recessive illness characterized by the presence of thick mucus in many organ systems, most notably the respiratory tract. It is screened for in all 50 states. Cerebral palsy is a disorder characterized by motor dysfunction resulting from a non-progressive injury to brain tissue. The injury may occur during pregnancy, labor, delivery, or shortly after delivery. Physical examination is required to diagnose cerebral palsy. Blood screening is not an appropriate means of diagnosis. It is important to realize that neonatal screening is state-specific. Each state determines which diseases will be screened for. In March 1915, the Advisory Committee on Heritable Disorders in Newborns and Children recommended that all newborns be screened for 32 core disorders and 26 secondary disorders. Unfortunately, many states screen for far fewer disorders. The nursery nurse is careful to wear gloves when admitting neonates into the nursery. Which of the following is the scientific rationale for this action? 1. Meconium is filled with enteric bacteria. 2. Amniotic fluid may contain harmful viruses. 3. The high alkalinity of fetal urine is caustic to the skin. 4. The baby is at high risk for infection and must be protected. The correct answer is 2. Amniotic fluid may contain harmful viruses. Amniotic fluid is a reservoir for viral diseases like HIV and hepatitis B. If the woman is infected with those viruses, the amniotic fluid will be infectious. Meconium is a sterile stool. The newborn will not produce gastrointestinal bacteria until a few days after delivery. Fetal urine is not highly alkaline. Although babies are at high risk for infection, there is no need for nurses to wear gloves routinely when caring for the babies. Immediately after delivery, the nurse is protecting himself or herself from the baby, not the other way around. By wearing gloves, the nurse is practicing standard precautions per the Centers for Disease Control and Prevention to protect himself or herself from viruses that may be present in the amniotic fluid and on the neonate's body. This question illustrates how important it is for you to read each possible answer very carefully. For example, you may be tempted to choose choice 1, but the fact that the option states that meconium contains enteric bacteria makes that answer incorrect. A full-term newborn was just born. Which nursing intervention is important for the nurse to perform first? 1. Remove wet blankets. 2. Assess APGAR score. 3. Insert eye prophylaxis. 4. Elicit the Moro reflex. The correct answer is 1. Remove wet blankets. When newborns are wet, they can become hypothermic from heat loss resulting from evaporation. They may then develop cold stress syndrome. The first APGAR score is not done until 60 seconds after delivery. The wet blankets should have been removed from the baby well before that time. Eye prophylaxis can be delayed until after the parents have begun bonding with their baby. Although the baby's central nervous system must be carefully assessed, Reflex assessment should be postponed until after the baby is dried and is breathing on his or her own. This is a prioritizing question. Every one of the actions will be performed after the birth of the baby. The nurse must know which action is performed first. Because hypothermia can compromise a neonate's transition to extrauterine life, it is essential to dry the baby immediately to minimize heat loss through evaporation. It is important for you to review cold stress syndrome. To reduce the risk of hypoglycemia in a full-term newborn weighing 2,900 grams, what should the nurse do? 1. Maintain the infant's temperature above 97.7 degrees Fahrenheit / 36.5 degrees Celsius. 2. Feed the infant glucose water every 3 hours until breastfeeding well. 3. Assess blood glucose levels every 3 hours for the first 12 hours. 4. Encourage the mother to breastfeed every 4 hours. The correct answer is 1. Maintain the infant's temperature above 97.7 degrees Fahrenheit / 36.5 degrees Celsius. Hypothermia in the neonate is defined as a temperature below 97.7 degrees Fahrenheit. Cold stress syndrome may develop if the baby's temperature is below that level. A healthy neonate does not need supplemental feedings, and if supplements are needed, they should be either formula or breast milk. There is no indication in the STEM that glucose assessments are needed for this baby. Babies should be breastfed every 2 to 3 hours. Feedings every 4 hours are not frequent enough. It is important for the student to know that a baby weighing 2,900 grams is an average-sized baby. They range 2,500 to 4,000 grams. In addition, because no other information is included in the STEM, you must assume that the baby is healthy. The answers, therefore, should be evaluated in terms of the healthy newborn. Hypoglycemia can result when a baby develops cold stress syndrome because babies must metabolize food to create heat. When they use up their food stores, they become hypoglycemic. A mother asks the nurse to tell her about the responsiveness of neonates at birth. Which of the following answers is appropriate? Select all that apply. 1. Babies have a poorly developed sense of smell until they are 2 months old. 2. Babies respond to all forms of taste well, but they prefer to eat sweet things like breast milk. 3. Babies are especially sensitive to being touched and cuddled. 4. Babies are nearsighted with blurry vision until they are about 3 months of age. 5. Babies respond to many sounds, especially to the high-pitched tone of the female voice. The correct answers are 2. Babies respond to all forms of taste well, but they prefer to eat sweet things like breast milk. 3. Babies are especially sensitive to being touched and cuddled. And 5. Babies respond to many sounds, especially to the high-pitched tone of the female voice. Babies respond to all forms of taste. They prefer sweet things. Babies' sense of touch is considered to be the most well-developed sense. Babies hear quite well once the amniotic fluid is absorbed from the ear canal. All newborns' hearing is tested prior to discharge from the newborn nursery. If a baby is found to be hearing impaired, the baby should receive early intervention. All of the baby's senses are well developed at birth. Babies see quite well at 8 to 12 inches. They prefer to look at the human face. A mother, 1 day postpartum from a 3-hour labor and a spontaneous vaginal delivery, questions the nurse because her baby's face is purple. Upon examination, the nurse notes petechiae over the scalp, forehead, and cheeks of the baby. The nurse's response should be based on which of the following? 1. Petechiae are indicative of severe bacterial infections. 2. Rapid deliveries can injure the neonatal presenting part. 3. Petechiae are characteristic of the normal newborn rash. 4. The injuries are a sign that the child has been abused. The correct answer is 2. Rapid deliveries can injure the neonatal presenting part. When neonates speed through the birth canal during rapid deliveries, the presenting parts become bruised. The bruising often takes the form of petechial hemorrhages. Petechiae can be present as a result of an infectious disease, for example, meningococemia. In this situation, however, there is no indication that an infection is present. Erythema toxicum, the newborn rash, is characterized by papules or pustules on an erythematous base. There is nothing in the scenario to suggest that child abuse has occurred. Although this question is about the neonate, the key to answering the question is knowledge of the normal length of a vaginal labor and delivery. Multiparous labors average about 8 to 10 hours, and primiparous labors can last more than 20 hours. The 3-hour labor noted in the stem of the question is significantly shorter than the average labor. The neonate, therefore, has progressed rapidly through the birth canal and, as a result, is bruised. A 2-day-old breastfeeding baby born via normal spontaneous vaginal delivery has just been weighed in the newborn nursery. The nurse determines that the baby has lost 3.5% of the birth weight. Which of the following nursing actions is appropriate? 1. Do nothing because this is a normal weight loss. 2. Notify the neonatologist of the significant weight loss. 3. Advise the mother to bottle feed the baby at the next feed. 4. Assess the baby for hypoglycemia with a glucose monitor. The correct answer is 1. Do nothing because this is a normal weight loss. The baby has lost less than 4% of its birth weight. Babies often lose between 5% and 10% of their birth weight. A loss greater than 10% is considered pathological. Supplementation is not needed at this time. There is no indication in the stem that the baby is at high risk for hypoglycemia. 4 newborns are in the neonatal nursery, none of whom is crying or in distress. Which of the babies should the nurse report to the neonatologist? 1. 16-hour-old baby who has yet to pass meconium. 2. 16-hour-old baby whose blood glucose is 50 milligrams per deciliter. 3. 2-day-old baby who is breathing irregularly at 70 breaths per minute. 4. 2-day-old baby who is excreting a milky discharge from both nipples. The correct answer is 3 2-day-old baby who is breathing irregularly at 70 breaths per minute. Normal neonatal breathing is 30 to 60 breaths per minute. This baby is tachypneic. Meconium should pass within 24 hours of delivery. This baby's glucose level is within normal limits. A milky discharge, witch's milk, is normal. It results from the drop in maternal hormones in the neonatal system following delivery. The pediatrician has ordered vitamin K 0.5 milligrams IM for a newborn. The medication is available as 2 milligrams per milliliters. How many milliliters should the nurse administer to the baby? Calculate to the nearest hundredth. To solve this problem, you set up the formula as 2 milligrams over 1 milliliters equals to 0.5 milligrams over x. You cross-multiply 2 times x and 0.5 times 1. You get 2x equals to 0.5. You divide 2 on both sides, and you get x equals to 0.25 milliliters. This is the amount that the nurse should administer for each dose. A nurse is doing a newborn assessment on a new admission to the nursery. Which of the following actions should the nurse make when evaluating the baby for developmental dysplasia of the hip? Select all that apply. 1. Grasp the baby's legs with the thumbs on the inner thighs and forefingers on the outer thighs. 2. Gently adduct and abduct the baby's thighs. 3. Palpate the trochanter during hip rotation. 4. Place the baby in a fetal position. 5. Compare the lengths of the baby's legs. The correct answers are 1. Grasp the baby's legs with the thumbs on the inner thighs and forefingers on the outer thighs. 2. Gently adduct and abduct the baby's thighs. 3. Palpate the trochanter during hip rotation. And 5. Compare the lengths of the baby's legs. With the baby placed flat on its back, the practitioner grasps the baby's thighs using his or her thumbs and index fingers. When assessing for Ortolani sign, the baby's thighs are abducted. When performing the Barlow test, the baby's thighs are adducted. With the baby's hips and knees at 90-degree angles, the hips are abducted. With developmental dysplasia of the hip, the trochanter dislocates from the acetabulum. The nurse would feel the dislocation while palpating the trochanter. Legs are extended to assess for equal leg lengths and for equal thigh and gluteal folds. When performing both the Ortolani and Barlow tests, the baby is placed flat on his or her back. When assessing for symmetry of leg lengths and tissue folds, the baby is placed in both the supine and prone positions. The order of the steps of the Ortolani procedure is 1. The nurse places the baby on the baby's back. 2. The nurse grasps the baby's thighs with a thumb on the inner aspect and forefingers over the trochanter. 3. With the knees flexed at 90-degree angles, the hips are abducted. And 4. The nurse palpates the trochanter to assess for hip laxity. The Barlow test is performed by 1. Adducting the baby's legs, 2. Gently pushing the legs posteriorly, and 3. Feeling to note any slippage of the trochanter out of the acetabulum. Galeazzi sign, to assess for uneven knee heights, can also be performed. A nurse notes that a 6-hour-old neonate has cyanotic hands and feet. Which of the following actions by the nurse is appropriate? 1. Place the child in an isolette. 2. Administer oxygen. 3. Swaddle the baby in a blanket. 4. Apply pulse oximeter. The correct answer is 3. Swaddle the baby in a blanket. The baby's extremities are cyanotic as a result of the baby's immature circulatory system. Swaddling helps to warm the baby's hands and feet. There is no evidence in the stem that would warrant placing the child in an isolette. Cyanotic hands and feet are not signs of hypoxia in the neonate. There is no evidence in the stem that would warrant monitoring with the pulse oximeter. You must be familiar with the differences between normal findings of the newborn and those of an older child or adult. Acrocyanosis, which is bluish cyanotic hands and feet, is normal in the very young neonate resulting from his or her immature circulation to the extremities. A couple is asking the nurse whether or not their son should be circumcised. On which fact should the nurse's response be based? 1. Boys should be circumcised for them to establish a positive self-image. 2. Boys should not be circumcised because there is no medical rationale for the procedure. 3. Experts from the Centers for Disease Control and Prevention argue that circumcision is desirable. 4. A statement from the American Academy of Pediatrics asserts that circumcision is optional. The correct answer is 4. A statement from the American Academy of Pediatrics asserts that circumcision is optional. The American Academy of Pediatrics, although acknowledging that there are some advantages to circumcision, states that there is not enough evidence to suggest that all baby boys be circumcised. There is no evidence that circumcision status affects a boy's self-image. No official statements have been published regarding the rationality of performing circumcisions. The CDC has made no policy statement on circumcision. A baby boy is to be circumcised by the mother's obstetrician. Which of the following actions shows that the nurse is being a patient advocate? 1. Before the procedure, the nurse prepares the sterile field for the physician. 2. The nurse refuses to unclothe the baby until the doctor orders something for pain. 3. The nurse holds the feeding immediately before the circumcision. 4. After the procedure, the nurse monitors the site for signs of bleeding. The correct answer is 2. The nurse refuses to unclothe the baby until the doctor orders something for pain. The nurse is being a patient advocate because the baby is unable to ask for pain medication. The American Academy of Pediatrics has made a policy statement that pain medications be used during all circumcision procedures. Circumcision is a surgical procedure that requires a sterile field and sterile technique. The nurse is performing safe practice in this situation. If a baby feeds immediately before the circumcision, he may aspirate his feeds. This is safe practice. Making sure the baby is not hemorrhaging at the incision site is also an example of safe nursing practice. Nurses perform a variety of roles. Being a safe practitioner is an essential role of the nurse. Just as important, and quite different, however, is the role of patient advocate, that is, providing support for the rights of a client who is unable to speak for or support himself or herself. Using the Neonatal Infant Pain Scale, NIPS, a nurse is assessing the pain response of a newborn who has just had a circumcision. The nurse is assessing a change in which of the following signs, symptoms. Select all that apply. 1. Heart rate. 2. Blood pressure. 3. Temperature. 4. Facial expression. 5. Breathing pattern. The correct answers are 4. Facial expression and 5. Breathing pattern. Facial expression is one variable that is evaluated as part of the NCLEX. Breathing pattern is one variable that is evaluated as part of the NCLEX. Although assessed in other pain scales, the heart rate is not part of the NCLEX. Blood pressure is not assessed in any infant pain scale. Temperature is not assessed in any infant pain scale. You should be familiar with the pain rating scales and use them clinically because neonates cannot communicate their pain to the nurse. The scoring variables that are evaluated when assessing neonatal pain using the NCLEX are facial expression, crying, breathing patterns, movement of arms and legs, and state of arousal. Other tools for assessing pain in the neonate are the Pain Assessment Tool, the Neonatal Post-Op Pain Scale, and the Premature Infant Pain Profile. A nurse is teaching a mother how to care for her 3-day-old son's circumcised penis. Which of the following actions demonstrates that the mother has learned the information? 1. The mother cleanses the glands with a cotton swab dipped in hydrogen peroxide. 2. The mother covers the glands with antifungal ointment after rinsing off any discharge. 3. The mother squeezes soapy water from the washcloth over the glands. 4. The mother replaces the dry, sterile dressing before putting on the diaper. The correct answer is 3. The mother squeezes soapy water from the washcloth over the glands. Squeezing soapy water over the penis cleanses the area without irritating the site and causing the site to bleed. Hydrogen peroxide is not used when cleansing the circumcised penis. Antifungals are not indicated in this situation. Dry dressings are not applied to the circumcised penis. It is, however, usually recommended to liberally apply petroleum jelly to the site before diapering. The petroleum jelly may be applied directly to the penis via a sterile dressing or via a petroleum jelly impregnated gauze. The circumcised penis has undergone a surgical procedure, but to apply a dry dressing is potentially injurious. If the dressing adheres to the newly circumcised penis, the incision could bleed. You should be aware that with routine cleaning, as cited previously, circumcisions usually heal quickly and rarely become infected.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.